Cure rates for HPV-related oropharyngeal cancers are high, but current treatments are harsh on patients, leaving them with long-term effects such as dry mouth, altered taste, and increased fatigue and weakness. The goal is to find effective treatments that minimize that long-term toxicity. Your head and neck specialist will determine the best treatment course for you depending on how advanced the cancer is and the status of your individual health. Dr. Neil Gross from the University of Texas MD Anderson Cancer Center explains more about robotic surgery.
Historically, surgery was used a lot for this disease, but the surgery was very invasive. It would require splitting the jaw or a very aggressive approach that, of course, nobody would want to consider. But coupled with that is that the disease has changed. So now we're talking about HPV-associated cancers, which are completely different than the tobacco-related cancers that were treated in the past with these open approaches. So there was this large shift historically from surgical treatment to non-surgical treatment based on poor outcomes for tobacco-related patients and with sort of outdated surgical approaches that don't necessarily hold up when we translate it to younger, healthier patients who have more favorable prognosis. The procedure is really only applicable, in my opinion, to patients who have small volume cancer, so small primary tumors. You know, these cancers start in either the tonsillar tissue on the sides of the throat, so what we think of when we think of tonsils, and also the tonsillar tissue that lines the back of the tongue. Patients who have HPV-associated cancers tend to have small primary tumors. They'll most frequently present with a lump in the neck. That's the most common presentation, but where that cancer starts is usually a small primary. And those patients are eligible for removal of the cancer with robotic technology, the same way that if you had a small cancer on the skin of your wrist or on the side of the cheek or the inside of the cheek, the first approach would be to remove it. If it's caught early, then surgery alone is a great option for patients. And that's why I think a lot of patients who have transoral robotic surgery are very, very happy because they can avoid completely radiation, they can avoid completely chemotherapy. Size matters, so the smaller the disease, the more favorable it is. And I think we're still learning a lot about how big is too big for this type of cancer. And it has more to do actually with the disease in the neck than it does in the throat. Because the primary cancer, the disease in the throat, tends to be small. It's the disease in the neck, that can sort of outpace the cancer in the throat. And that's where a lot of the treatment decisions are based, is on the extent of disease in the neck and how aggressive do we need to be because of that.